Welcome to the instructional video of the Auscultation trainer mat. So let's look at the components of this Auscultation trainer. We have got a laptop, router, the Auscultation trainer body and the speakers along with the stethoscope which can be attached to a smart scope via Bluetooth. This helps to learn various kind of sounds like heart sounds, lung sounds and bowel sounds. This trainer can be rotated 360 degree for anterior and posterior portions auscultation. It has various types of auscultation points, as in heart there are 5 auscultation points, anterior lung auscultation has 5 points and posterior lung portion has 6 points for auscultation. It has high quality skin and is resistant to mechanical stress. Many kind of pen, markers, sticky notes can be used on this and it can be cleaned again for the use. It has various anatomical landmarks like clavicle, ribs, muscles and soft abdomen. Now we will have an overview of the Auscultation software interface. As you can see, the window is divided into 3 areas. On the left there is a library of auscultation sounds of heart, lung and bowel. In the middle of the screen there is an image of auscultation patient and you can also see the respiration rate, heart rate, and here is a screen which will help you to see the waveform of heart as well as respiration rate. On this side of the screen, you can play with the sound settings. Using this slider, you can increase or decrease the volume of the sound. These buttons will help you to highlight the auscultation areas. So now you can see the auscultation points are highlighted. This will help the students to learn about various auscultation points and where to perform the auscultation. Now I will show you how everything works. For example, we will perform heart auscultation. Pay attention that if you select an area for auscultation, the list of sounds available will drop down, from where you can select various sounds which can be heard on the speaker mode or the smart scope mode. From the middle of the screen, you can select various auscultation points like aortic valve, tricuspid valve or some another auscultation point. In our case, I'm going to select the mitral valve, and you can see that here we have got an option to increase the volume of mitral valve, and this button will help you to highlight the mitral valve point. So now let's have a look at the uppermost portion of the screen. As you can see, here is an icon of speaker and here is an icon for smart scope. You can use the smart scope or the speaker mode for auscultation. From here you can increase or decrease the volume of the Auscultation trainer. Button will help you to check the connections. This will help you to highlight the auscultation points, and the another point shows that the smart scope is connected or not. So as you can see that smart scope is not connected right now. To connect the smart scope, switch it on by pressing on this button, and remember not to long press. Just press it once, and once it is on, you will be able to see a green light. Later you can check the connections from here. As you can see, the smart scope is connected now. This smart scope can be attached with any of the ordinary stethoscope. You just have to put a little force on this and this smart scope is ready for the use. To use this task trainer on teaching mode, you can use it on speaker, and if you want to use this task trainer or examination mode, you can use this smart scope. Here at the bottom of the screen, you have got an ECG button on which if you are going to press, you will get an ECG graph. By tapping on heart rate, if you increase the heart rate or decrease it, you will get the ECG graph accordingly. Similarly, you can do it for the respiration rate, where you get the graph for the respiration rate, and if you increase or decrease it, the variations will be shown in the graph. So here at the bottom you can also see a compare button. If you press on this, you will be able to compare 2 types of sounds. So here I have taken one normal heart sound, and next I'll be selecting the another sound, which is Austin Flint murmur. I'll be able to hear the difference in both of the sounds when I tap it. So this is the Austin Flint murmur, and when I tap on the normal heart sound, I'll be able to hear the normal heart sound. This helps to compare two types of sounds. At the bottom, you have also got a pause button. If you press on it, your screen will pause. And to run the screen again, just press anywhere on the screen. Here you have got a plus icon, which will help you to add any pictures if you want to add. This button will help you to visualize the waveforms on a larger screen. If you want to go back to the earlier screen, you just have to tap on this panel again. Here at the bottom, as you can see, we have got three buttons: mute all, default and max volume. Mute all will help you to mute all the sounds, and default will set the sound at 70% of volume. Max volume will help you to set at the max volume of the sound. Now let's have a look at the ports of the trainer. This port is USB-A type, which can be connected to the laptop. This is for LAN cable, and this is for power. From here you can switch on or switch off the task trainer. When it is switched off, the green light will turn off, and when you switch it on, you'll see a green light here. Thank you for watching. Please do recommend to watch this video to the surgeons and future surgeons.